Hi, Jackie Van Ruler here, and in today's video I'm going to be talking about some facial reflexology that you can do to help with neurodegenerative diseases like Parkinson's and Alzheimer's. If you're not already subscribed to my Instagram channel, I do post these face maps on Instagram, and I do that so that you can follow along with me and also so that you can do this on a regular basis without having to watch an entire 10 or 15 minute video, because that can get long and arduous, and you should just be able to do this. And what you can do is just place this beside the person that you're working on and use it that way. I do have it so that the left side of the face is over here, right side's over here, so it correlates very easily. When we're talking about neurodegenerative diseases, we're going to be working specifically with the kidneys, because the kidneys govern the brain and the nervous system. The brain is made up of 65% cholesterol and saturated fat. So if you are on a diet that is very low in cholesterol or saturated fat, or if you are taking a statin, which turns off your body's ability to make cholesterol, those things are going to be very prohibited to you healing and to your brain to regenerate and to detoxify. So please, please, please eat cholesterol and saturated fat. It is much healthier for you than you have been led to believe. And if you're on a statin, you can stop it cold turkey. You do not have to stay on it or even get your doctor's permission to come off of it. I would immediately stop it and see what happens over the course of a few weeks, because I've heard of several people who have started on a statin and then feel like their memory's gone bad, or they've just have had more muscle pain or things like that as well. So we will start with our kidney points. Place your fingers on the corners of your mouth, go all the way up to your hairline. If you don't sure where your hairline is, just guesstimate. You're going to come down about maybe a centimeter, half a centimeter, and you'll feel a spot where you can just kind of place that your fingers just kind of fall into. Those are your kidney spots. I'm going to start with my left kidney spot. I'm working in here. I'm working to see if I feel any lumpiness, any bumpiness, and I'm gauging how easy is it for me to move the magic wand in that area. Same thing on the right side, and I'm noticing that my right side's easier to move it than my left side was. Doesn't really matter which side is more or less easy, but just noticing that, and then spending a little time. If it's harder to move it, spend a little more time on that spot. Then we're going to come right to the center of the forehead. This area has to do with your mind, and so working in here is really good for improving memory. And in fact, you can also just take your finger and tap that center of the forehead if you're having a little bit of a memory glitch. So where did I put my keys? What is that person's name? You can tap that, and a lot of times that will just kind of trigger your memory. Coming down a little bit further, we have a spot for the pineal gland. So this is your third eye. This is a light sensing organ, and as we age, our pineal glands can calcify. So the majority of our brain has what it calls a blood-brain barrier. This is a layer of cells that protects the brain from toxins that you're exposed to in your everyday environment. The pineal gland does not have it, and so it becomes calcified very, very easily. And this happens with fluoride, calcifications, just things like that that happen throughout a lifetime. And so working this can help to detoxify that pineal gland. This gland is also really important for mysterious experiences, for things like serendipitous experiences, and just for like guidance and intuition, particularly guidance from God, intuition as to like different things that you should be doing. As we come a little bit lower, we get to the pituitary gland. Pituitary gland is your master gland. So it is all about deciding what hormones your body should be making, telling what endocrine glands to do their functions. Endocrine glands include the pancreas, which releases insulin, the thyroid, all of those things. Then we're going to come down here to the area for the diaphragm. So this is the area where your glasses would sit. As you work this, notice if you have the urge to take a deep breath. This is a really good way to get lymph moving. So when you're breathing, your lungs are expanding and contracting, and that expansion and contraction within the lungs is also propelling lymph throughout your body. Lymph is your body's sewage system. It helps to get rid of toxins and things like that that hang out in your body. So you want to be breathing really well, because that is going to help your body to detoxify. Then as we come down on the nose, we get point 1. This is actually energetically a third kidney point. This point has to do with your blood, And the kidney's job is to filter and to purify your blood. So as we're working this point, we're keeping our blood healthy, mineral rich, and nutritious for our whole body so that we have the energy that our body can use. Okay, then we're going to come up to the forehead again, halfway between the brow and the hairline. If you go right in here, you can just use back and forth motions, or you can do some circles in this area. On the right hand side here, we get a point for the gallbladder. The gallbladder is a really amazing detoxifier. So what it does is it's released when you eat fatty foods. Now, particularly your body really likes, especially your nervous system and brain, really likes that saturated fat and cholesterol, which I think we talked about before. Super, super important. Your brain is made up of 65% cholesterol, and your brain uses 20% of your entire body's cholesterol. Your body's always making it, but you also need some dietary cholesterol. So if you are on a low-fat diet, if you don't eat any animal products at all, this will eventually affect your brain. And babies, like when babies are growing, when they're born, their diet is so high in saturated fat and cholesterol. If you think of what breast milk is, it's a lot of fat, it's a lot of cholesterol, and they need it because their brains are growing. So if you're experiencing neurodegenerative diseases, in order to heal your brain, you need to eat more saturated fat and cholesterol. The one kind of fat you do not want to eat at all is seed oils. Seed oils are terrible for your body. They're terrible for your metabolism, and they cause diabetes. Incidentally, Alzheimer's is now known as stage 3 diabetes or type 3 diabetes, and it is caused by excess glucose, excess sugar, and insulin resistance. Seed oils actually cause insulin resistance in your body because it prevents the movement of oxygen and nutrients in and out of your cells. What it does is it replaces the cell membrane, which are usually made out of cholesterol, and they make it with these omega-6 fatty acids and linoleic acids, which are terrible for metabolism. And so eliminating all seed oils is probably going to be the #1 thing that you can do to improve your health and to improve your brain health in general. But please know that seed oils have a half-life of like 3 years, which means that they stay in your body for a total of almost 6 or 7 years. So when you stop eating it, you need to give it some time before you really notice the differences. And seed oils are in everything. Corn chips, fries, every restaurant uses it because it's super cheap. And so you really have to be careful. It's in most processed foods. So really take that out. That's going to be one of your #1 priorities if you're experiencing any neurodegenerative issues. And just if you're alive, it's probably one of the worst things you can do for your health is eating seed oils. Okay, now we're going to come to the left side of the face. We are in line with the side of the nose, directly underneath the iris of the eye. We've got the spleen. The spleen is the organ that is the largest lymph node of the body. So it's improving lymph, detoxification. Its job is also to filter out your red blood cells. And what it does is it filters the red blood cells, it breaks down the old ones that aren't doing their job anymore, and recycles the iron. So really important that your brain has plenty of oxygen. The spleen is important in making sure that your red blood cells are carrying plenty of oxygen to your brain and to other areas of your body. Now we're going to come to the right side of the face. So in line with the bottom of the nose, directly underneath the iris of the eye, we have the liver. And then just to the right of that, we have the gallbladder. So you can work this whole bottom of the cheek area. And the liver is one of your primary organs of detoxification. So actually your liver and your kidneys are. And so one of the things we want to do is detoxify the brain from any toxins that you've had over your life. So toxins can be from seed oils, as we've talked about. It can be from packaged foods, excess sugar. Excess sugar and glucose is going to cause fatty liver, it's going to cause insulin resistance, all these things that can lead to neurodegenerative diseases. Also, things like medications that you're taking have to be detoxified from your body. So you have to decide, are the medications I'm taking providing enough of a positive impact that the detoxification effect that my body has to put out this extra energy for, is it worth it? One thing that you do not want to ever take again if you are experiencing a neurodegenerative disease, if it runs in your family, or if you even just know somebody has, like, please talk them out of getting any more injections. Every injection, even if it's for shingles or the flu or the C word, they all have what's called an adjuvant in it. These adjuvants are heavy metals. So a lot of times it's mercury, it's aluminum, titanium dioxide. These different adjuvants actually do cross that blood-brain barrier that we talked about earlier. So while most medications and things don't, these do. And what happens is they lodge up in your brain and they kind of stay there. Alzheimer's specifically is very much associated with high levels of aluminum in the brain. So please, please, please do not take another one because it will cause additional damage. Okay, now we're going to do some points for detoxification. So we're going to work right in here. So upper lip, on the outer side, and then coming in right on this smile line. So these are points for the adrenal glands. So the adrenals sit on top of the kidneys and they release cortisol. When your body's stressed, it will release cortisol inappropriately. And 38 is a point for the large intestine, another organ of detoxification. But together, these points are good for reducing inflammation. And our main goal is to reduce inflammation in the brain and in the central nervous system. Okay, then we're going to come underneath of the lip here. This is a point for as a diuretic point, so this is also helping to improve any excess fluid, edema, things like that that you might have in your body. So another great point for detoxification. And then we're going to come to the chin, and this is a point for the bladder. So the kidneys and bladder are very much related. The kidneys filter your blood. They send all the excess waste products to your bladder, and then it exits your body through the bladder. Okay, and then we're going to work all around the ears. The ears are also associated with the kidneys. You can see that they have the same shape as the kidneys. Anything in your body that has the same shape as something else has that same energy. So as we're working this top part of the face, we want to go to where the top of the ear meets the face. This is a great point for the shoulders. If you think about where your brain is, if your shoulders are tight and tense, that fluid from your brain can't easily travel down into your body and be secreted. So we want to have nice, relaxed shoulders. And that's what this point does. For me, this point actually feels quite tight today. And then we want to work this right area right in front of the ear. This is a great lymphatic drainage passageway for the face and the neck. Coming down in front of the earlobe. We've got a point for the throat and the thyroid. Again, we want fluid moving very easily through our neck. And then coming up behind the earlobe, there's a little notch right behind the earlobe, and this is the brain irrigation point. So this is really good for moving cerebral spinal fluid. So this is going to irrigate the brain, clean out the brain. And then you're just going to do circles around the ears, getting all those points, making sure that you get that point 15 behind the earlobe. You're going to do it about 10 circles, maybe 15. And this is one that if you're dealing with neurodegenerative diseases, or if you know somebody, this is something you can do daily, even up to 4 times a day. And again, I do recommend making those dietary changes: higher saturated fat, higher cholesterol, eliminating all seed oils, and then really paring down on any carbohydrates, because we do not want to cause insulin resistance, and we want to actually heal the body from that if you're having any issues with the brain. Okay, again, we're working this top point where the top of the ear meets the face. This is opening up the shoulders, relaxing the shoulders so that fluid from the neck and the brain can flow easily, meld with your lymph, and then all of the toxins can exit your body. Working in front of the ear, up and down. This is opening up that lymphatic drainage passageway. When we're doing this, we're also getting point 0, which is the primary balancing point in the whole body. It also sets the formula into your body, helps it work more efficiently. Coming in front of the earlobe to work the throat and thyroid. Right in the back of that earlobe, you feel that little notch in there. Be sure and get this point good. This is that brain irrigation point. So we're literally cleaning the brain while we work this point. Okay, come up behind the ear and circle it. whole thing, we're just setting that formula in, helping it to work better. And I'd love to see what you notice with yourself or your loved one if you are noticing some of these issues going on, if it's memory, if it's some of that pre-shaking and stuff that comes along with Parkinson's. I have noticed in my clients that I work and do the pure energy facial meditation on that they have much less of that shaking following a treatment, and they have noticed that themselves. But this is something that you are training your nervous system. These neurodegenerative diseases often happen throughout your lifetime, and so doing 1 or 2 treatments isn't going to cause a huge difference because it's been something that's built up over time. So you have to be very consistent, be very on it, and be working these points and following that diet, and you will see changes, I guarantee it. Thank you for watching. I appreciate it. I do have a pure energy facial meditation class coming up starting September 6th and 7th. This is an incredible class for learning facial reflexology. You learn a specific technique, a specific sequence of points and zones that you can do on the face that cause amazing nervous system regulation. Your clients will love it. And we have a lot of people that take it just to help out their friends and family as well. So as always, thanks for watching, and I will see you in the next video.